Autism and possible links to acetaminophen during pregnancy and vaccines have been in the news lately.
So, we're talking with a doctor today about neurodivergence, including questions about diagnosis, treatment, and resources.
This is Enable, the Disability Podcast, where we'll share stories, experience, support, resources, and more for people with disabilities and different abilities. We are at Enable Podcast on social media. My name is Deaf Jeff Herbert.
And my name is Kurt Hower. We're talking with Salman Majeed, who is a psychiatrist and a clinical assistant professor of psychiatry at Penn State Hershey Medical Center. Thank you for joining us.
Thank you so much for having me.
Dr. Majeed, please tell us a little about yourself and your experience. How did you get involved with child and adolescent psychiatry and therapy?
Thank you. So I became interested in psychiatry about 20 years ago. And at that time, there is still significant stigma. At that time, it was even worse. And there are all kinds of misconceptions. And for child population, that was also while rotating during my child and adolescent rotations, seeing the kids and seeing against all the misinformation that if we intervene at a younger age, we get better outcomes. So much can be treated and prevented if more interventions are done early. So that motivated me to choose child and adolescent psychiatry.
Well, lately, a lot of questions have come up about pregnant women and Tylenol, that it can cause autism or ADHD. Is that true?
Scientific community is not agreeing. There are some articles, but not enough to pinpoint what is causing. It's very easy and simple to find one cause because we want to identify and blame something. Maybe it is this medicine or maybe it is that vaccine. But right now, all the experts in the field are not convinced that there is a simple one part of answer to those questions. So, of course, if somebody is not in pain, they do not have to take any medication, and that is ideal. These medical decisions and recommendations, they have to come from medical experts. And right now, it feels the political side is driving that force. That's not the right direction.
Thank you.
The FDA said it's changing labels for acetaminophen, noting that potential risks while saying it remains reasonable for pregnant women to use in certain scenarios, such as a high-grade fever. So, what would you recommend patients ask their doctors about what's best for them?
If there is alternative, they could take that. But I think the question is, do we have enough scientific evidence to find one culprit? And that's also, it's very difficult. Let's say we find anything else and ask, are we 100% sure that somebody who ate, let's use the example, who ate cheese or who ate a certain food or tomatoes, that if somebody ate a lot of XYZ ingredient in their food, who is to come and say, no, that does not make sense? So it is a question. So of course, it has to be investigated. But I think we need science and investigations and those experts to first look at all those. Now, because of that question, of course, if somebody asks me and they're pregnant now that acetaminophen has been in question, we need to look at evidence. But I think that medical recommendations should not be based on non-scientific, non-medical ways of giving that recommendation. So I would be hesitant based on now debate about acetaminophen, but medical community is not seeing any reason to agree with that recommendation.
Well, in the news lately, there seems to be a lot of talk about a significant increase in the diagnosis of people who have autism and autism spectrum disorder. And some are claiming that it's often associated with vaccines. In your experience, why have there been more diagnoses? What do you think?
People are more aware. So, for all of the mental health conditions, there is more awareness. So, if 40, 50 years ago, people look back at their classroom setting and they saw maybe some of their classmates who did not socialize well or who did not acted in the right way, many times people just call them names or different or weird or all those without any medical explanation of their behavior. So now as we are more aware, also same thing happened for ADHD, that those kids who acted out, they just got punished, and negative attention and punitive methods to address that. Now as we are learning more about the brain and child and adolescent development, everybody's looking more deeply. So if a child is not making eye contact before, maybe was not um, on anybody's radar. So one major part is there is more awareness. Even parents who are not as knowledgeable, they would know that if child is not making eye contact, is struggling socially with making friends or maintaining their emotions, they will go and get that checked. So increased awareness and access to the care. Even the field of child and adolescent psychiatry itself, it is 50, 60 years old. So if a field is new, all the diagnosis, if we compare to 50, 60 years ago when there were no child and adolescent psychiatry training programs, education, awareness, of course, that creates a bias. There was one study about link with vaccine, but that was even the author agreed or shared that they had misrepresented the facts. Now, there is some link with the timeline. Some of the symptoms for autism, for social interaction, they become more prominent as the child starts to grow, as we expect more social interactions. So, certain milestones that are achieved at 1 year or 2 year mark, they also coincide with the times of their annual visits and checkups. So everybody is also more aware. So sometimes it is a link of that wrong association. The child was already not reaching those other milestones, but they were subtle at a when child was baby was a month old or a few months old, everything with significant amount of time for sleep. So those signs are difficult to pick. But as child is growing and going for their follow-up appointments at the same time, that's the vaccination schedule. So then it is a link of what caused it. But if we deeply look, most of those infants, so social smile starts usually at about 4 weeks. So most, and same thing with eye contact for babies, that even starts sooner. So if we look deep enough, we'll find that that child who was diagnosed, usually diagnosis happens in toddler age, but if we get history, we'll find that child was not making regular eye contact as other babies would, or was not so giving that social smile. There is another feature of shared attention where baby will start pointing at things with the parents looking at the same thing around 6 to 9 months. So that also gets affected. But these are so subtle that most parents who are not trained in the child development, they will miss those signs.
Hmm.
So you alluded to some of the signs that parents should look for if they think their child might have autism. Are there other signs that develop or are more noticeable as the child gets older that parents can look for?
Yes, definitely. So it is primarily social communication disorder. So as we communicate, we naturally have social reciprocal behavior and exchange. So as child is growing from toddler age to school age, as they come across more kids of their age, it becomes more noticeable. So with adults or parents, that interaction is different. Parents can talk, they're aware of child's self-centeredness or looking at the view from the egocentric view, which is from their point of view. As they interact more with kids of their age, which becomes more prominent for school age children who have not been in daycare, those symptoms of social communication, difficulties in making friends, keeping friends, those become more prominent. And emotion regulation is another piece because the child, the view or the communication is very different. So that creates emotion dysregulation that others are not seeing what I am seeing. So then the ability to regulate emotions, also it's developing even in neurotypical children, that develops over first few years of life. But with autism, there is added challenge of regulating emotions. So we'll see irritability and those social communication problems.
So my child has autism, and what kind of treatment or resources do you recommend for treating it?
And autism, it's a spectrum. So there are, on one end of the spectrum, we have children who are nonverbal, not communicating verbally at all. And and then we have other spectrum where things are very subtle. The communication is they can verbalize, articulate um, well, um, and their functioning so is highly advanced. So we use the word high functioning autism on the other side. So it depends where child is, and but at the core of it, it is social communication processing error. So if depending on where the child is, we have to meet them where they are and work on that communication. It's just like for any other diagnosis when we look at the accurately getting to where things are and then meeting the child where they are and then slowly to what they can tolerate, giving them some challenges to what they could achieve, like keeping the bar accessible that they can meet those expectations. So if they can meet those expectations, the bar, then we could slowly raise the bar, but it has to match the communication part, going through different social stories and different scenarios. Even while watching shows, we could, for kids' shows, we could look at different characters or what was the point of view from different sides, and then applying to their situations. So that social communication is the major foundation of the learning. So, for example, a child, if it is diagnosed early, if you could help them develop their ability to communicate if they are not verbal, that makes the communication makes the biggest difference. So there is that educational component, and many schools are adding more support and help for social emotional development as well. So if we could help them with where they are, and setting more supportive environments, that could make a huge difference. Usually, intelligence is not an issue with autism. Actually, many children with autism are gifted in many other ways. So, finding their talents, sometimes we just focus on things that are not going well. But all of us who were successful, that was because we worked on our strengths as we try to continue working on our weaknesses. So finding the child's strengths and helping them grow, develop that confidence. So that makes a huge difference. And then it is case by case. We look at what are the needs for that particular child. Is there comorbid, which is coexisting ADHD or any anxiety or any other condition. So then it is a holistic approach to treating those symptoms. So then there is role for medications, but we don't usually start there. That is more for if child is not able to regulate. Otherwise, then we look at medication options.
What about parents and coping mechanisms, that kind of thing? Because my child's newly diagnosed, and that may hit you like a brick wall.
Right.
What do you recommend or suggest for parents?
Right. So that is a great question. And it is for parents, it is um, a little bit of grief process. It is because we have a fantasy or imagination of what our child would be. And now they have this disability of any sort. If they thought, for example, using a physical health, let's say somebody has leg disability, and so there will be grief process for the parents. Same thing for those with congenital with type 1 diabetes who get diagnosed early. There will be that acceptance and grieving process. Go through that and reach that acceptance. Now, for autism, because it's invisible, many times it shows with the behavioral problems. So it requires even more patience. Parents could go through anger and sadness and significant frustrating moments themselves. So the goal is for all of us to look at where our children are and accept them and meet them where they are, and then help in that process of growth. With autism, also many parents worry that will my child be able to sustain themselves? Will they have regular career? And yes, that is particularly for those who are medium to high functioning. There are so many ways for them to have successful careers and live their life. But if we do not accept, on the other side, there is sometimes we go in denial where we say, no, it's just if I try hard enough or if the child tries hard enough, we'll grow out of it. That sets up a cycle of frustration and failure. For example, using that example of I wear glasses, if my parents don't accept, or any parents, for their child's vision, and they keep straining that no, you have to see the blackboard or whiteboard on this and you be able to see. Now that's creating a type of stress that the child won't be able to see that clearly. It's just going to create more burden on the child because they are not able to. Versus this, with this analogy, adding the support of glasses, now they can see clearly, they can learn better. So same way for approaching the diagnosis for autism, that accepting, seeing where the pain points are, slowly, gradually seeing. Many kids will have a significant growth on different points, and adaptability is another point for kids with autism. They could have cognitive rigidity, they could get stuck on different things. So developing, if all parent also approaches that with strict approach, hard disciplinarian, now it creates significant tension and conflict. Let's say if one parent is getting that point of high frustration with the child in that given moment, it's better to take a break. It's better to ask for support, ask for other parent, ask for another family member, because many times parents could also lose their emotional cool. So approaching that more thoughtfully rather than more reactively gives better results in the long run, even for shifting the behaviors. So that building more support around them, depending on that where the child is on that spectrum.
I think you make a great point about how because because it's a spectrum, there's so many different. There's no one size fits all treatment for autism spectrum disorder. So I'm also curious about for adults. Are there different recommendations for either when a person is diagnosed with autism as an adult, or when a child with autism becomes an adult and eventually, oftentimes, will be living independently?
So in intelligence helps, particularly those on the high functioning autism part. Their intelligence helps. The those on the extremes, they're easier in that sense, like completely nonverbal, where everybody agrees that let's not expect too high from the beginning. Let's just focus on the basic needs, functions of activities of daily living. So those kids get help. Those on the high functioning and sometimes their intelligent, supportive environment, they could also go under the radar. The middle group with less extreme, either spectrum or also with not having those additional um, supports, they struggle more. So as they get diagnosed, the element of first, first is understanding where the pain points are, where they are struggling. Usually it would be social relationships. So for person themselves to understand and accept, and then having that discussion with the family members. Many times people would take that, if we are talking about adults, they would take that I always felt I didn't belong, or I was an outcast. So that feeling of that lack of connection. So if we approach, depending on what symptoms somebody is presenting with, also some adults, they take relief when they find out finally, and usually it happens in context of a child getting diagnosed, or some other way of learning, when they connect the dots that this I've been acting this way the whole life, and this is what's happening. There is that relief of it, that I am not lesser. There is a term, there is some situation I could understand why my relationships have been struggling throughout the life.
Yeah, thank you. And thank you so much, Dr. Majeed, for taking time out of your busy schedule to spend with us. And do you have any closing thoughts that you would want to share with our audience?
Thank you so much. And it is a joy to be with you guys. The closing thoughts, I would say, about stigma and misinformation, that this is still a problem. We live in a time of information overload, and it's very easy to get misguided. So it's important to find trustworthy resources and educate and reduce stigma. So humanity, we are all unique. We are all different. Same thing with, particularly with people with autism. So it's not one size fits all. Acceptance of each other and our differences, our own struggles, and respecting that, when we come across others who are struggling with something different, we might understand, we might not understand, and asking those questions and respecting and accepting that, um, this is where other people are, and then learning about that and finding more trustworthy resources, so that we could all learn the right way. And also for stigma, that misinformation and targeting the those with the certain diagnosis, so that definitely hurts. It's not that person's fault. If we can't help in some ways we should not judge them either. So more embracing those who are struggling.
Yeah, we recently interviewed a father. His son has autism, and he said, it would be better if people showed more grace and empathy. And
Right.
I think that's not. I think that's spot on.
Thank you. Yes, that would make a huge difference for people who are struggling.
Thank you, Dr. Majeed. Thank you again for joining us. This is Enable, the Disability Podcast. We are at Enable Podcast on social media. Please like, follow, and subscribe.
And please share this podcast with your family and friends so we can help more people with disabilities and different abilities and bring us all together.